Dr. John Torous, are you with us this morning? Good morning, Dr. John Torous. Are you with us this morning?
It doesn't sound like not yet.
Oh, there we go.
Hey, good morning.
Good
Welcome.
morning.
Good morning. This is JP Cathy and the crew. I'm JP. Thank you for joining us this morning.
Yeah, thank you so much for having me.
So happy to have you on. Thank you, Doctor.
And you are calling in from Massachusetts, is that right?
I am. So a little bit far away from you guys, but not too far. The world's getting smaller with technology.
It is.
Amen
It
to
is.
that.
That's a great lead in. How cute was that? The world is getting smaller with technology. What would we might be talking about today? A little bit of technology. How
Technology.
about the fact that Dr. John is the director of digital psychiatry at Beth Israel Deaconess? Is that right?
It is.
Medical Center. So I want to thank you for joining us. Also want to thank Patty and Steve for joining us here on the Mental Health Moment. Again, this is their brain trust, their brainchild, something for Kelly and the Morgan Foundation came up with this idea, and JP Cathy and the crew and 1160 AM KBDT has run with it. And so Dr. John Torous, thank you for joining us this morning. Patty, Steve, what a great guest here.
We are so excited to have Dr. Torous with us. It's so timely. We were talking about this in the car on the way coming here. We couldn't possibly have been so prescient. So we want to just jump right into it, Dr. Torous, and ask you to give us your background so that everybody understands your areas of expertise.
Yeah, so I'm a board certified psychiatrist, but I'm also a board certified clinical informaticist. So there aren't too many physicians who take extra training in clinical informatics. And you may even say, what the heck is clinical informatics? It's kind of the medical subspecialty where we deal with large data, we deal with machine learning, we deal with technology systems like medical records, with smartphone apps, with different types of data. So I, as a psychiatrist, I see patients. As a clinical informaticist, I work with data systems. And I also run a research group here at Beth Israel Deaconess Medical Center, and a division actually of digital psychiatry, where we really look at how can we use technology to augment, extend, and improve mental health care, not to replace, but to make it better and stronger.
Dr. Stephen Dunn here. Doctor, you sound like you have a very unusual background. I understand you first got your undergraduate degree in electrical engineering. How in the world does an electrical engineer from Cal Berkeley become an MD?
So it's a good question. There actually are a couple of psychiatrists that I know of that have taken this path from electrical engineering or computer science and kind of gone through medical school and then gone through medical training to become a psychiatrist. But I think the story of a lot of us who kind of taken this path is the same, that a lot of us were probably one night up all night programming, probably having too much screen time. We can talk about that later. But really thinking about programming and computer science and electrical engineering is really exciting. It's really important work. But sometimes it can be a little bit isolating when you're kind of trying to make a piece of computer code compile, or you're waiting there going, why doesn't this thing work? And sometimes the team aspects of working in medicine and healthcare can be really exciting, and they can kind of bring the same rigor and approach and kind of problem solving and methodology as you bring to engineering. You can also bring to medicine to healthcare, and certainly engineering is a team-based field now, there's no doubt. But I think medicine has a lot of human interaction. You're working with diverse teams, with diverse patients, with diverse tools. So I think it was that diversity and that kind of ability to connect with more people that made me excited to kind of finish up my engineering degree and then kind of head to UC San Diego for medical school.
Okay, very well. Doctor, we find ourselves now in perhaps the most unusual time globally that we've experienced in centuries. And because of such, there is both a panic and the reality of what is going on. So with that background, the Trump administration last week came out with 3 very unusual initiatives regarding providing healthcare. So let's start to go into those. Can you briefly talk about the first initiative pertaining to dealing with patients across state lines?
Yeah, so let's put this in context. Clearly, as we're having more social distancing, which I'm going to call a misnomer, it should be physical space distancing. We don't want people to socially isolate. We want you to be in contact with people. But as we have these precautions that are having people stay at home and not kind of being proud, clearly getting to a doctor's office, a clinician's office, a therapist's office, a social worker's office, a nurse practitioner's office, these things are harder now. So what the administration did last week is kind of release some unprecedented changes that kind of increase access to really telehealth, kind of video visits, and given what we're talking about, really increase access to telemental health. And the first way that they kind of increase this access to telemental health, and I'll also start with a caveat that these are temporary measures. These are valid for 60 days as of last Wednesday, and they could equally change before then. So everything we're going to talk about is really in flux. I mean, these are certainly dynamic times. And these new rules came out, I think, on March 17th. But what they really did is CMS, the Centers for Medicare and Medicaid, really said that kind of they would kind of offer reimbursement for telehealth across state lines. So traditionally, if I'm a psychiatrist in Massachusetts, I have my board certification there. The state of Massachusetts has said, John, you can practice psychiatry in Massachusetts. But if I wanted to work with you guys out in the great state of Texas, I currently do not have a medical license in Texas. So if I was doing a video visit to you guys, I actually am practicing medicine in Texas, right? I'm kind of beaming in via my video system to you guys. That would be something that would be practicing medicine without a license. And what these new rules are basically saying is the government now is saying we are going to actually offer payment for those services across state lines, because it's important that, again, if some psychiatrist or mental health provider can offer access and care, they should be able to reach out to people in this time of emergency. That said, states offer medical licensing, not the federal government, unless you work for the Veterans Administration,
Right.
A different system. So what's interesting, though, is each state will also decide, do I want to grant, in this case, John, a temporary waiver to practice medicine in Texas? So it's one thing to be able to do it. It's one thing, of course, to be reimbursed. So what the federal government said is they can kind of hold reimbursement for CMS for Medicare, Medicaid patients, for patients with kind of more federally offered insurances. So they're kind of offering the payment, the incentive. What the states say is different per state.
Thank you. Thank you so much, Doctor. There's a second initiative that goes along with that first one, and it has to do with HIPAA and the platforms through which people are communicating or telehealth generating. Could you talk a little bit about that one now?
Exactly. So what is different is traditionally, if you're going to do a video visit, the platform kind of technology that you would do the video visit with had to kind of pass certain benchmarks of security. What the government has said is temporarily during this emergency, it is okay to use platforms that may not have that same level of security or encryption. So it is okay to use kind of FaceTime if you have an Apple phone, or Skype to kind of offer these visits if there's no alternative available. And again, this is for 60 days, it's temporary, but the point being almost everyone may have in their pocket with a phone already the right technology to use and connect to a psychiatrist or therapist.
All right, sir. Now, in terms of the third, and I think perhaps the most perhaps controversial initiative, can you go into that?
So the third initiative was basically the Secretary of Health and Human Services saying that we're going to, in essence, temporarily waive something called the Ryan Height Act. And this is saying that it's now possible to prescribe controlled substances via telehealth without, and the key word is without first having an in-person, face-to-face visit.
So what do
And
you
the
mean by
idea
a
of this-
controlled substance, doctor? So specifically, like, what's an example?
So a controlled substance, again, an example would be benzodiazepine medicines, perhaps like Ativan would be an example that some people may be familiar with or know.
Xanax?
So Xanax exactly would be
Okay.
the same family of medications. And again, traditionally, again, the rules before last week really said, look, if we're going to be prescribing, we first need to have at least one in-person visit. And there are rules that would kind of say, and you have to have somebody follow-up visits in person. Other ones, yes, can be via telehealth and video. And again, only during this emergency. So this is not a permanent rule. This is an exception. It said, but from 60 days, we're going to kind of waive this. And as psychiatrists need to do this, they are kind of allowed to prescribe these substances.
So, doctor, tell us how this is going to work during this 60-day window in time.
So how this could work again is it's kind of designed to allow psychiatrists to offer kind of all the resources to make sure people can get the right care that they need. So, and again, all of this could change as well. Many of these started last week, as Steve said, so we're not fully sure kind of what will come next. But again, for now, you can prescribe these controlled substances via telehealth without an in-person visit.
All right, we're going to take a quick break. Of course, if you want to continue to catch the action, you can go to JP, Kathy, and the crew on Facebook and social media. We'll be continuing the conversation with Dr. John Torous, coming to us live from Massachusetts. And so stay tuned. Also, when we come back, traffic and weather on the 824 hours. So you definitely want to stay tuned for that as well. We're 1160 a.m. KBDT. And we're back.
Doctor, so as I understand it, these initiatives only pertain initially to people who receive Medicare. Is that correct?
So I think some of them, we'd have to go back and read the rules, but I think some of them do apply to Medicare and Medicaid and people with kind of diversion for children. So I think there's a waiver that granted it, and it may be Medicare, it may be Medicaid, it may be children, but I think both of us would have to go read the fine print and double check.
So as I understand it, Medicaid is more administered on a state-by-state basis. Is that correct?
Yes, you are correct.
And in terms of private pay then, the individual health provider companies have their own rules in place, and technically these initiatives do not pertain to them. Is that correct as well?
So this is a really good point that you bring up. In essence, everything we talked about before is kind of what the federal government is saying for kind of Medicare, Medicaid plans that it controls, it pays for. If you have private insurance, clearly the rules are going to be set by that private insurer, what they do. Traditionally, private insurance and kind of healthcare companies follow the lead of the federal government, especially what CMS says. But again, because everything we've talked about is kind of these temporary emergency measures that are not intended to be permanent, it's unclear how actually private insurance companies are going to follow this. There's nothing in the law that says anyone else has to do this, has to offer it. So you're correct that it's unclear what other companies, especially private ones, will do.
And then as I understand, as well as we were talking yesterday, even when you have private pay, some of them are giving exceptions to the self-insured plan. So let's say if you have a big company like Raytheon or Apple that has a self-insured plan. For the people who don't know what that is, it's basically the company pays the claims as they come up. The insurance company just appoints an administrator to work the claims, but the revenue to pay the doctors and the claims come from the employer, from a fund the employer has set up. As I understand it, these self-insured plans often have their own separate rules and regulations. Is that correct?
So, no, that is correct. I think for anyone listening who's wondering, what am I covered with? What can I do? For any providers listening going, what can I actually practice or not practice in these kind of dynamic times? I think I would say one is call that insurance company, that your kind of person who's offering these benefits, and just ask them, because again, it could be changing week to week, and say, look, what is actually in effect now? I know these things are changing. So I think it's a good time actually to pick up the phone, review your plan, again, your provider, even call your state medical board, go to your website and say, look, what is actually going on right now?
So is there do you know of a place on the net where a person can go to start to look at?
Okay, hold on thought.
Hold that thought.
Hold that thought.
Good morning. Welcome back to 1160 AM KBDT News Talk Sports. Discover America's news from a Christian perspective, point of view. Today from noon until 2. It's currently 8:24 in the Dallas-Fort Worth area.
All right, and JP, we've got 70 degrees currently. We're headed towards a high of 85. A little bit cooler tonight, a low of 56.
All right, give you a quick update on your Dow futures. You are up 930 points. Mr. President, I'll tell you, I know Frank doesn't think that politics and the market mix sometimes, but in these times they do. His announcement that it's time to get the American people back to work has given a boost of confidence back to the market. Again, up 930 points. You're trading at 19,427. We'll get you an update on your NASDAQ and your S&P here in just a little bit. So anyways, we are visiting with Dr. John Torous. Again, thank you so much for joining us. Great background, of course, with technology and with psychiatry. First of all, what's your temperature up in Massachusetts?
You know, we had snow yesterday, so I'm going to say you guys are doing pretty well out there.
You know, you can have my 85-degree humid weather.
JP wants your snow. He's tired of sweating.
Yeah, I want your snow. I'm tired of sweating through the winter. So you're welcome to it.
I think it's the beard.
It could be. This is my coronavirus mask. So, Dr. John Torous, we're talking about all of this and the fact that we've relaxed it. We're allowing now for more telemedicine and virtual counseling. We can write prescriptions now, so long as we're under this nationally public health emergency. But here's my question. Have you been able to utilize this relaxing of telemedicine and virtual counseling? And if you are, how are you getting clients that are calling in that you're being able to help?
So I think what we're seeing, I'll speak in broad terms, is a lot of medical centers and clinics are quickly adjusting to be able to offer video visits either through the computer or through your own smartphone. So because, again, a lot of mental health can be done through talking to someone, in essence, kind of mental health, behavioral health, psychiatry, therapy is really suited to kind of telepsychiatry, these video visits. So I think we've seen last week a lot of, again, clinics, a lot of clinicians were quickly making this transition of saying, look, how do we get up and running and offering these video visits? But I think we're seeing, at least of colleagues that I know kind of across the nation, a lot of people are up and running. Last week, I talked to Peter Yellowlees, who's one of the leaders at the UC Davis Medical Center in California. And he basically explained that last week they converted their entire department to be able to offer video visits. So I think the switch is almost already done for most people, or if not, finishing up.
So, doctor, then what are the benefits of telehealth or telemedicine? The pros and cons, if you would help us out.
Yeah, so telemedicine actually has been around for a long time. It started with phones. One of actually the earliest studies, you can imagine that someone was nervous or kind of anxious driving on the Los Angeles freeways and was calling their therapist on one of those early car phones. Clearly, that would be illegal today. You cannot be on a non-hands-free device and talking in a car. But the idea is that you can connect with a mental health provider using technology in so many different settings and so many different places. And we've actually had telepsychiatry, kind of these video visits. They've been around since as soon as we had telecommunications, as soon as we've had even TVs. So there's been a huge, rich legacy of research to say kind of these video visits can work in really any mental health condition. The only contraindication to kind of telepsychiatry video visits for mental health conditions is someone who doesn't want to consent or doesn't want to do it. It can work in eating disorders, it can work in schizophrenia, it can work in depression, it can work in anxiety disorders. It can really has a strong legacy. And again, there's decades of evidence to kind of say, look, these video visits can be equally as effective as in-person visits.
And what does this do for the professionals? What kind of risk are they taking on by doing this without being in person with the patient?
So I think certainly the risks are going to be different for every patient, every kind of interaction people see with. But generally, the risks of telepsychiatry are not substantially different than in-person visits. I think there's always safety concerns as a psychiatrist seeing people. We want to make sure that they're safe. And certainly, but even when doing video visits, we take precautions where we figure out, we ask someone where they are, we ask for emergency contact information, we have a plan of what to do if they're feeling unwell or unsafe. So the risks are there. And again, they may be a little bit different, but overall, there's not a higher risk of kind of adverse outcomes or negative events with doing these kind of video visits.
Doctor, thank you. Hold that thought. We're getting ready to take a break. When we come back, we will continue the conversation. We're 1160 a.m. KBDT News Talk Sports. All right. Okay, let's continue the conversation.
Doctor, now, as I understand it as well, since these are emergency provisions that were put in place because of COVID-19, in part it was done to reduce the exposure between our medical providers and the patients out there. Is that correct as well?
So that's correct as well. And actually, there's been a couple even published journal articles coming out from China kind of saying that they were even kind of using video visits and telepsychiatry pretty quickly in this crisis because of, again, the need for isolation and kind of stop the spread of the virus.
So in part, the administration was trying to anticipate that hospitals and emergency rooms could just be swamped with people with COVID-19. So in response to that fear, these provisions were also put in place. Is that your understanding?
I think that's an accurate reading of it. Clearly, too, I think, again, as some people need to self-quarantine, as it's not advised for people to kind of be traveling throughout the cities, perhaps using public transit to get to clinics or therapist's office. I think that was another reason to kind of have something like this in place, right? Make sure people can access mental health care no matter where they are.
Also, since Doctor, I've got a nephew who's serving up in the Pentagon right now. When he was serving abroad, he picked up an immune system disorder.
Like an autoimmune kind of issue.
You know, this kid is 30 years old. He's otherwise healthy, but his system is a bit compromised. So as I understand it, the rules were also put in place to protect people like him who, if he had more exposure in a hospital or an ER, it's more likely that he would pick up COVID-19. So is this also designed to protect the people who have immune system disorders?
No, exactly. It's kind of in protecting those people and making sure that everyone stays safe, we also don't want to limit access to mental health care, right? So I think these emergency response were to say, look, people still need access to high quality, effective mental health care. Perhaps you could argue now more than ever, given kind of the additional stress everyone is under. So these measures are really to say, look, we need to do some drastic things, but that doesn't mean we have to decrease people's access to mental health. And again, I'll say that these measures around telehealth are broader than mental health, but mental health is one of the main beneficiaries because everything is so applicable to telepsychiatry.
Doctor, you talk about the access that we want everybody to have. What about the non-Medicare patients that are out there? What should they be doing to be able to continue to get access to mental health?
So it's very likely that their provider has switched over to video visits. And I would actually suggest that they, one, reach out to their provider and kind of ask, are there video visits? If they're unsure, I'd also quickly call that number on the insurance card and just ask, what do I do now? But it seems that kind of access to kind of telepsychiatry video visits, as we said earlier, it'll vary by different insurance company what they're offering. But I think this is a case where everyone in the world really wants to do the right thing. We want to make care accessible. So it seems that really everyone is trying to kind of offer access through these video visits. But again, it's hard to speak for every single insurance plan across the country.
Thank you, Doctor.
10 seconds.
About to
Good morning. Welcome back to 1160 AM KBDT News Talk Sports. Don't miss Wayne Allen Root, raw and unfiltered, this afternoon from 5 until 8 p.m. It is currently 8:34 here in the Dallas-Fort Worth area.
And JP, the sun is peeking out from behind the clouds. We're headed literally just as I was about to say the weather. We've got a high of 85 today, a low of 56, and currently we're at 70 degrees. Why are you making those?
Because
sounds?
I'm about to start sweating.
Oh,
I need
that's good for you.
I need telemedicine and virtual counseling. I'm tired of sweating. When I get off the phone, I'm calling Dr. John Torous and telling him I need help to get through all this. Anyways, good morning and welcome back to JP, Kathy, and the crew. We got the mental health moment. We have sitting to my left, we have Patty Giolet. I love it. I say it wrong, but I still love it.
It's good.
And was something
Sounds
for
all
Kelly
fancy.
It is fancy.
Something for
She
Kelly.
is
Happy to be
fancy.
here.
And Stephen Dunn with the Morgan family.
And he doesn't ever say your name fancy.
Good evening.
Or wrong.
Or wrong.
Kind of hard to get that one
Oh,
wrong.
I love that.
And then joining us remotely from his remote studio, our expert in all psychiatry and technology, Dr. John Torous. How do you like that? Was pretty good, I thought.
Thank you, guys.
I thought that was pretty good
That
there,
was.
Dr. John. I thought that was pretty good. You know, here's the thing. The bottom line is when you became a psychiatrist, what drove you to do that? In a matter of 20 seconds.
In a matter of 20 seconds, the mind and the brain are the next frontiers for huge advancements in science, medicine, and healthcare. There's so much we can improve on even today in year 2020.
So how do we apply your love and your desire to helping people across the board? And how do we spread that good cheer?
So I think that we spread that good cheer by being curious and open. I think the biggest barrier sometimes facing mental health is stigma, which is often fueled by kind of lack of understanding and sometimes lack of compassion. So I think having an open mind is saying, you know, these mental illnesses are often brain-based illnesses. There's so much we don't understand about the brain and the mind. And the potential for kind of new discoveries, new treatments, new prevention strategies is really unlimited. And again, we've explored space, we've kind of gone to these new frontiers, but really it may be the time to look inward and say, what are all the exciting new things that are going to come from kind of brain science? One of them is going to be kind of really improving mental health for everyone.
So here, let's say that in a perfect world, you have a captured audience, at least 100 million Americans captured right now. And let's say in the next 6 days, everything is perfect and everything goes back to normal. COVID-19 is eradicated, but you've got 6 days to where you can begin to address the stigma, the shaming, the misunderstanding of mental health, and you've got this captive audience. How can the world of psychiatry, especially with this virtual healthcare now, with this opportunity that we've been given to be able to connect with people on their phones, connect with people on their computers, even more so than before, how can we do something in 6 days and make a big impact?
So I think the big impact that we can make is to show people it's okay to embrace innovation in mental health. It's okay to use technology to connect to your mental health provider. Not only is it okay, it probably works really well for you, and you probably enjoyed and liked that experience. You probably got the care you needed more efficiently. That probably meant that your mental health provider, your psychiatrist could see more people and increase access to care. So I think that this crisis may help people understand that it's important that we take next steps in mental health care and delivery, and that we don't forget that we could use technology to increase access and availability during a crisis. After the crisis ends, I think it's important to say, we can begin to go even further. We can begin to explore how well things like mental health apps, how well things like virtual reality, how can we make sure those tools are ready for a new crisis? How can we make sure those tools are ready to increase access to care as soon as possible?
So how do we get that out to 100 million Americans that are locked up in their house? How do we get you on Fox News, NBC, MSNBC, CBS, ABC? Because here's what's spiking right now, right? We have child abuse being seen that is spiked, at least in the Fort Worth, Dallas area. We've got more children being taken into the hospital as a result of being locked up in their homes with their parents, and everybody being driven nuts. And we have, that's probably not the right term to use, and that's what's probably not good. I apologize. Although I think it's kind of funny because I remember the Barbara Streisand movie Nuts. So anyways, I digress. Point being is that we're seeing a spike in child abuse with the lockup in the houses. We're seeing a spike in domestic violence, and we're seeing a spike in mental health. How do we get Dr. Oz, Dr. Sapphire, all these people that are on television that have millions of people following them talking about this right now? How do we do that now?
Well, and doctor, you're also seeing a spike in animal abuse. There was a case in Collin County where a group of teenagers, and again, why are these teenagers out in a car together, threw a puppy out of a fast-moving car window.
Oh my.
Yeah. Now, luckily, there was a good citizen there who rescued the dog. But again, it's all over. It's all over, and it's increasing.
But how do we get that on television? How do we get millions of people listening to Dr. Oz, Dr. Sapphire, Dr. Fauci? All these people are listening. Now, how do we shift the conversation to mental health, COVID-19 mental health? How do we do that?
I think the conversation is naturally going to go there regardless, because let's try to project even a month into the future, 2 months into the future. There's evidence from the past of kind of looking at prior economic downturns. Hopefully we don't have one. But if we do have an economic downturn, really kind of rates of mental health conditions really kind of go up because of the additional stress of economic downturn. So it's possible that certainly I think we're going to do everything we can now to beat this virus, to kind of get it under control. But I think we do have to kind of consider what are kind of the mental health sequelae that may result of this, and how are we going to have a system that's ready to kind of treat perhaps a lot more mental health issues that people want help for in the coming weeks and months and even years after.
And so that leads me into my next question, which was a perfect lead in, which is how do we take what has been relaxed, make it a continuation, and continue to provide mental health at the comfort of people's homes on a much larger scale? How do we keep what we've now got relaxed in place for the next year and use it as a study to determine if it's effective or not?
So hard to know how to change federal legislation. A little bit outside my scope. What I can say is, let's introduce two new words: synchronous telepsychiatry and asynchronous telepsychiatry. You may say, what the heck do these mean, synchronous and asynchronous?
It sounded kind of sexy, actually. I was kind of hoping you would say it again, and you did. So thanks for doing that.
So synchronous telepsychiatry really is just kind of, you are talking to someone in real time, right? You're in sync. It's happening. I say something, you respond. This conversation is synchronous.
Right.
Asynchronous telepsychiatry is something where I send a message, a text message, I send a video clip, and someone responds later on, right? There's not a real-time interaction. So if you think about it, asynchronous telepsychiatry has the potential to reach even more people, right? Because we don't need one person engage with one person directly. You could perhaps have one person responding to 10 kind of different messaging forms, right, with asynchronous telepsychiatry. And I think really what this crisis has showed us is we need to begin to understand better how we can begin to use new innovations around asynchronous telepsychiatry. How can we kind of begin to extend providers and multiply them? So we've increased access to care by, again, letting people access video visits from their homes, not having to go into offices. But the next step is, again, say, can we now kind of multiply our providers? Can we look at using new technologies and new innovations? And I think the reason that the government relaxed a lot of these restrictions around video visits was, I guess we said there's decades of research to show these video visits are effective, they're safe, they work well. For some of these newer technologies, again, let's say like mental health apps, we have some good evidence coming out, but we don't have that kind of robust, strong evidence that would make legislators likely confident to change the law to kind of make them frontline treatments. So I think that as we look forward, it really says, can we really begin to quickly invest in learning about how these kind of new technologies for mental health work, equally which ones don't work, and can we have the evidence base, the compelling stories, the compelling data to say, look, this is ready to go. And again, that work has already started, but I think all of us around the world can see that it needs to go faster.
Doctor, we are at a time now where we're beginning to see our high-tech companies like Apple and Amazon, Google get into healthcare. For example, we know that Apple just announced last month a collaboration with Johnson & Johnson to further improve their app and technology on AFib. Do you see a time in the next 5 to 6 years where a collaboration with them could lead to technology that would be able to in real time take a drop of blood from someone and have our doctors be able to determine what their phosphorus and magnesium and potassium levels are?
So I think you bring up a really good point, especially for video visits for telehealth to work. Let's just say in eating disorders from cardiology, having the right data at hand makes a difference. And sometimes, again, in prescribing psychiatric medicines, in prescribing medicine for heart diseases, we need lab values. And that is one of the limitations sometimes of these kind of digital systems. So innovations that would kind of allow us to kind of, again, look at blood, get these measurements out from home are very important. If any of you kind of saw, I think there's an HBO special in this company called Theranos, and there was a book written called, I think, Bad Blood. And again, we have to be, it's a good, certainly, cautionary tale that company kind of told the world they could do these kind of point of care blood testing. You could just give a drop of your blood and they would kind of basically get you these impressive results. It turned out that was a massive fraud. And again, so it's not to say the idea is not good. The idea is excellent and it's important. But I think in some cases we're so excited and even desperate for these things to work that sometimes we're willing to kind of not ask the hard questions, say, hey, does it really work? what is the evidence? And I think it's more important than ever as we kind of realize the need for all these new medical technologies. We can't let kind of our drive for innovation surpass our drive to say, look, it still needs to work. We're going to ask the hard questions. You don't get a free pass because it's new. You get us looking at it, you get us excited, but we're not going to take something that doesn't work.
So, doctor, this really opens up the door to a lot of scams then. So what else is out there that, or how do people pay attention to the concerns that you're raising here?
You know, I think if you go onto the App Store right now and you type in depression, you type in anxiety, again, some areas that we work in, there's a lot of mental health apps there that you can download immediately. And again, I think some of them are going to help people, some of them aren't going to help people. It's going to vary by person. But a lot of times, we did a study that we published last year, and what we found was usually the App Store descriptions of these kind of at least mental health apps, they kind of overstate the medical evidence, the kind of what the app can do for you. And we basically found that almost 50% of these kind of apps on the app stores were kind of saying, you know, we're based in medical evidence, we're supported by clinical science. And what our team did, led by Mark Larson in Australia at the Black Dog Institute, we actually kind of tracked down those claims and said, are they real? Are they real? Has this company actually done what they said? And what we found is about 2% or less were actually kind of backed up by real medical science. So you kind of go from nearly 50% to 2%, you go, wow, that's a big gap.
Wow. Actually, I go, wow. Just kidding, Dr. Torous. I just had to make fun of that. Real quick, when we come back from the break, what can people do that feel like tensions are boiling in their homes with COVID-19 and the lockdowns that keep coming, it seems like? And how do you talk to your children about COVID-19? And how do you make this thing bearable as we go through it? Can you answer those questions for me when we come back?
We'll give it a shot.
All right. Sounds good. I'm all about that. That's for sure. All right. When we come back also, I'm going to give you an update on the market and what the market is doing because things are looking brighter as the president is committed to getting people back to work. That's the hope that we needed to hear. Let's get back to work and do what we do best. We'll be right back at 11:60 a.m. KBDT. All right. Dr. Torous, can you hear us?
I can.
Yeah,
Sounds like you guys can hear me too.
Yeah, if we can give some folks at home some management training, just real basic, basic stuff. Like one of the things I used to tell people in the courtroom when they would talk to their kids is that if they felt like the argument was escalating to the point of where nobody was listening, to take a kitchen timer and put 5 minutes on it, and everybody went to their designated areas and had 5 minutes to kind of take a break, catch their breath, and maybe start thinking a little clearer, and then come back and continue the conversation. Just little tips like that if you have those.
I think that one's pretty darn good. We can maybe deputize you.
Yeah, after 28 years of working with kids and families, probably could get an honorary degree in psychiatry somehow, I would think. But yeah, so, a timeout for everybody, designated areas, but any kind of little workarounds that you might have when mental health, because this is situational mental health or environmental mental health, with having this lockdown and 100 million Americans being locked down, parents now having to teach their kids from home.
And work from home at the same time.
And so become the teacher and become the parent. So if you could just kind of give some quick, because this last segment, we're only going to have just a few minutes.
Right.
And I mean, let's put there's no doubt there's so much stress that people are under. There's stress kind of from perhaps being in the house. There's a lot of stress about uncertainty about the future, about the illness, about potential jobs. And I think we have a lot, we know a lot in psychiatry that kind of stress is not the friend of any mental health condition. I don't think there's any of them that stress kind of makes better. And I think this almost harks back, it can almost sound corny, but if you think about it, there's a lot of things that we do in our daily lives kind of before this. We had routines when we would likely go to sleep. We had routines on even how many steps we would take, perhaps exercise, around what we would eat. We probably would kind of, if we're having alcoholic beverages, they were likely in moderation on certain days. And I think if you look back and just take like an inventory of what behaviors are you doing differently now? And again, they have to be different. But thinking about, are those things, again, like sleep, alcohol consumption, even kind of making sure you're not sitting all day or sedentary, how are those different? Because those have been things that have been likely protecting people's mental health. And now that we're kind of all closer to, we have so much stress, we're kind of at such higher risk, things are kind of boiling up. Those kind of background protective things that we didn't really pay too much attention to. We knew they're important. People have told us,
1 minute.
Our mothers have probably nagged us, our clinicians and psychiatrists have probably said these things, but I think in this day and age, those actually become absolutely critical to make sure you're kind of maximizing your opportunities to kind of benefit from kind of, again, the right amount of sleep, trying to at least be as active as possible. You can still go outside for walks, making sure you get sunlight. I think some people may not be opening
Natural
their windows.
vitamin D. Absolutely. I've been talking about that. Like today in DFW, we actually have the sun coming back out. I think we've had this bad combination of all of this rain combined with the fact that you feel cooped up. That natural vitamin D is huge.
Yeah. So you want to make sure, again, we have to do things to stay safe, to keep our community safe. But I think we
10
also have
seconds.
to say, what are the things that we can do kind of in our daily lives to help our mental health?
Good morning. Welcome back to 1160 AM KBDT News Talk Sports for JP, Kathy, and the crew. We come to you live Monday through Friday from 7 a.m. to 9 a.m. Catch us on Alexa by walking by her and going 1160 a.m. and they're going to bring her on up. She's listening anyways, so you might as well listen to her as well.
Big brother.
Also, BigDTalk.com. Also, Facebook at JP, Kathy, and the crew, or on the old-fashioned dial here at 1160 a.m. Currently 8:54 in the Dallas-Fort Worth area.
JP, we've got 70 degrees currently, headed towards a high of 85, and the sun is coming out. Low tonight of 56.
We'd like to thank Acadia Healthcare for being our sponsor for the Mental Health Moment. Chris Getz is a advanced treatment placement specialist who is waiting to take your call. If during this time here, during the COVID-19 time, you need help, you can have a private conversation one-on-one with your specialist from Acadia Healthcare at 469-400-7499. Again, that's 469-400-7499. Let her know you heard it here on JP, Kathy, and the crew. Real quick, give you a market update. The Dow Jones doing amazing in the futures. We're up between 11 and 1,300 points. The S&P and the NASDAQ also up between 100 and 115 points for the S&P futures, and NASDAQ 375 points. So market looking good. Big announcement from the president that we are going to get Americans back to work here shortly. All right. With that being said, I've given Dr. John Torous a huge task. Tell us how we can manage our confinement and we don't go stir crazy.
So I think we're going to really look at sleep. Are we actually still, we can get outside, we can do walks, we can get exercise. Are we getting sunlight? Are we kind of making sure we're not using more alcohol or substances than we usually do? Are we trying to keep some routines and some patterns? I think, are we actually making sure we change our pajamas in the morning? Again, simple things, sometimes called lifestyle interventions, but critical now more than ever, given how much stress that people are under.
So how about managing our children as we take on the role of teacher, principal, counselor, parent, and employed parent working from home?
It's a lot of roles to balance at once.
That's why I did. That's the impact.
And you're the expert.
And I think it certainly makes us value and appreciate all of the people that help us out in our lives more than ever. I think the one thing I can say is, as we know, you don't need a mental health screen. Our children look up to us. They follow our example. They follow what we do. And especially in these times of crisis, I think it's all the more reason for us to try as possible to kind of set the right example of keeping routines, focusing again as possible on education, And again, leading a good example of kind of how we can try to be productive, how we can try to be hopeful. And certainly, again, there's going to be times where tempers flare, we get upset, but remembering this is going to be a time that's likely imprinted in a lot of children's minds. I think for listeners, younger children, I mean, remembering 9/11, I think people have really strong memories of that. And the hippocampus, the part of the brain that does memory formation, really can make very strong memories kind of in times of crisis. I think all of us remember where we were on 9/11. So remembering that, kind of our children are going to make very strong memories and learn a lot from this experience. For some people, it can be a good reminder of we may have to go even a little farther to kind of make sure we set those right examples.
You know, and to really set this out, how about let's go to our seniors in high school who feel like they're missing out on their entire senior year. What do you say to a parent who needs to talk to their senior?
So I think it's hard for a lot of students. Imagine for athletes who are really training for exciting seasons coming up and really can't train. I think we heard that the Olympics is kind of in jeopardy now.
It's postponed a year. Yeah, doctor.
So it's now postponed a year. I think what it's, again, telling people is this is something that's going to be temporary, and there's going to be, there'll be more seasons, there'll be college sports, there may be extra seasons, but making sure that you kind of stay physically healthy now and mentally healthy now means that you're ready when we kind of get back to normal in business. So I think really kind of putting yourself at risk now or is not going to help you because this will end.
Well, and I think that's probably the key message. This will end at some point and things will get back to where they need to be for you. So that's a good idea. That's great advice. You know, make it your day. Make it your best day possible as you control your moment. I like that.
Absolutely. Absolutely.
Well, Dr. John Torous, thank you so much for joining us from Massachusetts. Enjoy your snow while I sweat in Dallas.
Thank you guys for having me.
Stay healthy.
All right. Bye-bye. Take care.
Thank
Steve,
you for joining
Patty,
us.
thank you so much.
Thanks
We
for allowing
appreciate
us,
y'all.
as always.
And we'll talk to you tomorrow.
We
Have a
will
blessed
talk to you tomorrow.
day.
Have a blessed day. All right. Dr. John, are you with
Thank
us still?
you.
I am.
All right.
Excellent.
Fantastic.
Because we're
All
still
right.
on Facebook, and this is going to be will be shared by Steve. This portion of the show.
All right. And Steve, any other questions you guys want to ask for our Facebook audience?
Yes. You know, Doctor, after World War I, there was a song and an old saying that goes, how are you going to keep them down on the farm now that they've seen gay Paris? You know, these temporary rules that are supposed to be in place, do you envision they're going to become much more mainstream now? And even though there might be some penalties under HIPAA, our counselors and therapists are going to continue to use this type of technology to reach out more.
So if you look at historical precedents, once you kind of increase the access to something, offer people something, and they like it, generally they find ways to keep it going. I think what we will see is after kind of the emergency ends, we're going to definitely see the normal rules and regulations go back into place. But I think what will be different is we're going to see new lobbying efforts, new kind of efforts from patients, from hospitals, from providers, from companies saying, hey, why are we kind of limiting telehealth in these different ways? Let's find ways to make it acceptable. So I think we're going to see things go back to normal for telehealth, these regulations. But I think as you alluded to, we're going to see people saying, let's actually make that happen. So it's definitely, I see it's going to change.
Doctor, thank you. That's really about all I have. You know, so appreciate your time the last hour. I know for you, it is just hectic times, and there was a shutdown order entered up there, and you're having to deal with that new reality. So thank you so much for your time today, sir.
No, thank you guys for having me, and thank you for the wonderful show and all the messages that you're spreading and all the hope and information you're sharing with people.
Thank you for that. We're trying to open up this conversation of mental health so it doesn't have, like you talked about, the negative stigma. That we're trying to do away with that in whatever small way we can.
A lot of good information this morning. Thank you, Doctor.
Thank
All
you,
right.
guys. Stay well.
Dr. Torous, take care. You stay well as well. Thank you again. All right, everybody. That closes us up. Great commentary. Love the conversations going on Facebook. Feel free to share this out. It had good information, and it may be able to help somebody that lives near you. So, all right. Anything else, Kathy?
Have a blessed day. And tomorrow we've got another mental health professional coming in who's part of a global task force that has put a global website together that has all kinds of mental health resources for the coronavirus, for COVID-19 in particular. So Christy Lewis will be in tomorrow. Super excited about that. And then Thursday, yeah, y'all are going to want to tune into this because it all kinds of, and our show is going to be a resource because of the mental health moment. So it'll get global exposure. And then Thursday morning, first thing right off the bat, we have Congressman Van Taylor calling in. So we'll get his updates. I can't even imagine how much his head is exploding over Nancy Pelosi and her shenanigans. I can't even imagine. So stay tuned.
Absolutely.
All right, everybody have a blessed day. Thank you all for joining us
Thanks, everybody.
here on JP, Kathy, and the crew. All right, end live video.
John, what are you doing during the day most days now?
Holy cow, I have zero time taking care of my dad.